Our final witness for the morning is Dr. Mona Hanna-Attisha. She's coming by way of Skype. Dr. Hanna-Attisha is director of Hurley's Pediatric Residency Program. A Michigan native, Dr. Mona completed her residency and chief residency at Children's Hospital of Michigan and earned a master's degree in public health at the University of Michigan. In addition to educating the next generation of physicians, she also directs the Michigan State University and Hurley's Children's Hospital Public Health Initiative, a public health program to research, monitor, and mitigate the impact of lead in Flint's drinking water. Welcome, Doctor.
Thank you, Representative Cummings.
Good seeing you again.
Good to see you as well. I'd like to begin by thanking the Platform Committee for inviting me to talk about the Flint water crisis. I'm pleased you have chosen to devote time to talk about the crisis and the urgent and ongoing needs of the citizens of Flint. And I especially appreciate the ability to talk via video. The Flint water crisis touches on so many issues that are vital to the future of this country. These include issues of water quality, aging infrastructure, public health, poverty, injustice, austerity, and the loss of democracy. The Flint water crisis is also about our priorities, and most importantly, how as a nation we prioritize the future of our children. I'd like to remind the committee that today in Flint, we are in our third year of water that is not safe to drink. Even though many of the cameras are gone, we are still in a state of emergency. I was in clinic this morning seeing patients, and the kids I took care of today, they cannot go to their kitchen sinks and drink tap water without an approved lead filter. We're grateful for the federal emergency, for the Obama administration support, and for the federal agency support, especially for Flint-specific Medicaid expansion. However, despite the heroic efforts by our congressional leadership, Dan Kildee, Senator Stabenow Peters, and as you, in addition, Representative Cummings, Congress has so far failed to take any action in regards to Flint. The origins of the Flint water crisis has roots in politics and politics, but today Flint's recovery should not be a political issue, and moving past this crisis must be a nonpartisan humanitarian issue. In 2011, Flint was almost bankrupt and under emergency management, and as a cost-saving move in 2014, Flint changed its water source to the local Flint River without doing something that was necessary, without adding corrosion control, and that created a perfect storm for lead to leach out of our lead-based infrastructure, going to our drinking water and going to the bodies of our children. And as you know, lead is a potent, irreversible neurotoxin that has lifelong and multi-generational impacts. There is no safe level of lead, and it is a form of environmental injustice, disproportionately affecting our low-income and minority children. However, in Flint, we are moving forward. We will not be defined by this crisis, but rather our response to this crisis. And we are hoping to build a model public health program. We are hoping to wrap our children around with evidence-based interventions to promote their development. But we cannot do it alone, and that's why we still need the help of the federal government. The Michigan legislature recently passed a budget that will bring some of these services, but it's a one-year budget. We need long-term commitment, and we need congressional bipartisan support. And what we hope to learn from Flint, we hope to share with the rest of the nation, because as we hear, there are other communities throughout this nation facing lead crises and also facing issues of extreme poverty. We believe that with bold, rapid cycle initiatives, we can help Flint kids not only recover, but also thrive. And these initiatives include eliminating ongoing lead exposure, not only from water, but from other sources, reinvesting in public health, especially in environmental health, ending childhood poverty, which is a disease that afflicts our children's development synergistic with lead, investing in early education. We know that what we do in a child's 0 to 5 years of life will mitigate the impact of lead and help promote their development. Improving nutrition access. Flint has currently no grocery stores, no full-service grocery stores. We need great nutrition to promote children's development and to mitigate the ongoing exposure to lead. And revitalizing economy. People ask me as a pediatrician, what is the one thing that you would do to help your kids? And that's jobs, good living wage jobs for our families, to boost them out of poverty, and to provide support for their families. The crisis in Flint is a failure of government at so many levels, but only a robust, prolonged, and creative government commitment will rebuild Flint and restore the shaken trust of Flint citizens. And like I said, we are committed to not be defined by this crisis, but our response to the crisis. And with the nation's help, in 5 years, we hope that the word Flint will be synonymous with opportunity, hope, and recovery. And we hope that with the nation's support, the party's support, everyone's support, you can see that our smart, strong, and beautifully resilient children in Flint will continue to thrive. Thank you so much for the opportunity to testify today, and I look forward to any questions.
Dr. Zogby, thank you very much.
Mona, I just want to start by telling you how proud I am of you and the work you're doing in Flint for the nation. But the story of Flint is a crisis on top of a crisis. It's an economic crisis and now an environmental disaster. I remember when Flint was a thriving community and had factories, it had workers, it had a community that was prospering. And on top of this now we have this crisis. I want you to just think down the road for me a minute, 20 years, if we don't do something. What happens to the children of Flint now who are living this environmental nightmare? What happens to them? Where do they go? What becomes of Flint 20 years if we don't? And are there things we can be doing for these children now, after we clean up the water, after we deal with these issues? Are there things we can do that would help, in some cases, remediate some of the damage that's been done to their young lives?
Absolutely. That's a great question. Flint did not always mean disaster. Flint was the birthplace of General Motors, the birthplace of unions, the birthplace of the middle class. We used to have the highest per capita income in the nation, the best public health indices. And because of disinvestment, which led to unemployment, which led to poverty, it created this crisis. So this is not just a water crisis. This is a buildup of so many socioeconomic issues. So if we do nothing, we will see the consequences of lead poisoning. It is well known what the consequences of lead poisoning is. It decreases children's IQ, it causes behavioral problems, decreases their economic potential, and causes lifelong trajectory-altering consequences. That is if we do nothing. But we have the potential to do something. Science has taught us that brain development has plasticity. We can manipulate it, especially in the early years. And if we throw every single intervention around these children now, such as early education, early literacy, universal preschool, school health services, nutrition, healthcare, we can mitigate the impact of this exposure. We cannot take this away. It is irreversible. However, we can definitely mitigate it and limit the impact of this exposure. And that is what we need to do, because these kids did nothing wrong besides live in a poor city that was almost bankrupt, that didn't treat its water properly. We owe it to them to do everything to try to mitigate this. And we are going to be assessing this and sharing our experiences for other communities struggling with similar socioeconomic issues.
Again, I want to thank you, Doctor, for all you've done and continue to do. I've said it when I was in Flint and in our committee. It seems as if there's some folks in our country that don't mind other Americans being collateral damage. And I know that's a strong phrase, but it's real. We're going to continue to fight. But thank you very much. Any other comments, questions? Thank you.
Thank you.
Ladies and gentlemen, we're going to break for lunch. We will come back in exactly 1 hour. That's about 5 after, I think. All right? Thank you.